All right, let's dive into something that, let's be honest, affects every single one of us, the American healthcare system. It's really a century-long story, full of amazing breakthroughs, but also a ton of unintended consequences and just fierce political fights. To really get a grip on where we are today, we've got to go back and see how we got here.
So, have you ever just stopped and wondered, why? Why is our system so incredibly complicated, so expensive, so controversial? Well, the answer is kind of surprising. To find it, we have to go back to a time when healthcare wasn't really a problem at all. And that's because, frankly, it wasn't worth much.
Okay, so our story really kicks off in the early 20th century with what some historians call medicine's Big Bang. Now, this wasn't one single event. It was this revolutionary period where medicine went from, well, mostly just making you feel comfortable to actually being able to cure you. And that one shift, it set everything else in motion.
I mean, just think about it. Before the 1920s, going to the doctor was cheap, sure, but that's because a lot of the time it didn't really work. It was kind of more snake oil than real science. But then, boom, a whole wave of discoveries changes everything. All of a sudden, medicine could literally save your life. And with that incredible power came a brand new, very big problem, a massive price tag.
And we're not talking about small tweaks here. These were absolute game changers. We're talking about effective surgeries, antibiotics, real diagnostic tools, stuff that actually worked. Healthcare went from being this kind of folk remedy to a powerful, desirable thing, almost overnight. And what happens when something becomes that valuable? Well, everybody wants it, no matter what it costs.
And that, right there, that is the crucial conflict that has defined American healthcare for more than 100 years. How does a society figure out how to pay for something that is both essential for life and incredibly expensive? Seriously, every single political battle, every policy we're going to talk about comes right back to this one fundamental question.
So the first real answer to that huge question didn't come from some big, thought-out government plan. Nope, not even close. It was an accident of history, born out of pure desperation during the Great Depression.
So check out how this chain reaction played out. It starts in 1929, the Great Depression hits, and hospitals are on the verge of collapsing because nobody can pay their bills. So, in the 1930s, to keep themselves from going under, they invent these Blue Cross plans, basically prepayment programs. Then you fast forward to World War II. The government freezes wages. So how do companies compete for the best workers? They start offering health benefits instead of a bigger salary. And just like that, our employer-based system wasn't designed, it was born by accident.
And, this new system was a pretty clever fix at the time. It solved that big payment problem for millions of working families. But, and this is a huge but, it had a massive flaw baked right in. It tied your health security directly to your job. So what if you were retired, or unemployed, or worked a low-wage job that didn't have benefits? Well, you were just left out. And that created a whole new political crisis.
By the 1960s, that flaw had turned into a full-blown national crisis. You had the elderly and the poor totally left out of the system with nowhere to go. And that is when the federal government decided to step onto the field in a huge way.
But wow, this was not an easy step. The political opposition was fierce. Opponents, including a then actor you might have heard of named Ronald Reagan, framed this whole idea not as a safety net, but as a dangerous move towards socialized medicine that would destroy American freedom. This quote really gives you a sense of just how intense that fight was.
Despite all that opposition, President Lyndon B. Johnson made it a centerpiece of his Great Society agenda. And on July 30th, 1965, he signed Medicare and Medicaid into law. And that fundamentally changed the government's role in American healthcare forever. It was just a monumental moment. So the solution seemed pretty clear. Medicare would cover older Americans, 65 and up, and Medicaid would cover the poor. It was a direct fix for the two groups who had been left behind. And you know what? It worked. Millions of people finally got access to care they couldn't afford. But in solving the access problem, it unleashed a brand new beast. Think about it. With the government now paying the bills for millions and millions of Americans, and with new medical tech popping up all the time, the country entered a completely new era. And this one was defined by one single overwhelming issue, the battle over skyrocketing costs. The numbers here show an absolute explosion. Before Medicare, healthcare made up about 5% of the U.S. economy. By the late 1990s, that number had tripled. So what happened? Well, with the government and insurance companies now footing most of the bill, there wasn't much of a reason for anyone, not patients, not doctors, to control costs. The spending just kept going up and up and up.
This kicked off a decades-long obsession in Washington to find a fix for these rising costs. In the 70s, the Nixon administration pushed HMOs. In the 80s, the focus shifted to changing how Medicare paid hospitals. Then, by the 90s, President Clinton decided to go for the whole shebang, a complete, top-to-bottom reform of the entire system.
But, as this quote from his chief opponent, Senator Bob Dole, shows, the political will just wasn't there. The plan was attacked as a complex government takeover, and those same old arguments about socialized medicine that were used against Medicare came roaring back. The whole effort collapsed, and the cost problem? It just kept on growing.
So after a century of all these fixes and failures, where does that leave us? Well, it leaves us with a giant, unresolved debate, one that has been raging right underneath the surface this entire time.
It turns out that from the moment medicine became truly valuable, every single argument, every policy, every political fight, whether we're talking about employer insurance or Medicare or HMOs or the Affordable Care Act, it all comes back to the same two core questions. And here they are. First, what is the government's proper role? Should it be the insurer, a regulator, or should it just get out of the way? And second, how do we actually get a handle on the costs that are draining families and businesses? And the really tricky part is, these two questions are completely tangled up together. You can't answer one without affecting the other. And this brings us right up to the modern era. With the Affordable Care Act in 2010, you can think of it as the latest and maybe the biggest attempt to answer these same two questions. For the government's role, its answer was regulate, subsidize, and require. To the question of cost, it tried new payment models and insurance rules. And the ferocious political battle that followed, it just proved that we are still fighting the same fundamental war 100 years later.
So, after 100 years, we're still caught in the same tug of war. Access versus cost, government versus the market. It seems like every time we solve one problem, a new one pops up somewhere else. The central challenge hasn't really changed at all. The real question is, in the next chapter of this unfinished story, will we finally find a different way to answer it?